This presentation is part of a series of presentations on the guideline development process. My name is Liset Pengel, and in this presentation, I will discuss stakeholder involvement throughout the process. Stakeholders can be defined as all of those who might be affected by a guideline. Several groups of stakeholders can be defined and include the following. First of all, there are the patients, their carers, and patient organizations. Individuals or organizations that provide care, those financing it, pay for it, or reimburse for health-related interventions, purchasers such as employers or governments, policy-making entities such as professional organizations, product makers, which include drug or device manufacturers, principal investigators, for example, researchers, or lastly, the press. It is increasingly expected that stakeholders are engaged throughout the entire guideline development process. Major organizations now recommend involving stakeholders such as the WHO and NICE. Engagement of stakeholders during the guideline process has been shown to ensure the identification of priority guideline topic, and it also ensures comprehensive assessment of evidence and other considerations. Stakeholders can provide valuable evidence in the form of personal testimonies or experiences from individual patients or views from patient organizations. Involving stakeholders will ensure that recommendations consider evidence, cost, adverse events, and values and preferences. Stakeholder engagement will lead to greater acceptability and feasibility to the end users. It will support the adoption of recommendations in policy and practice, and this in turn may lead to improved adherence to any treatment and practice that is recommended. Stakeholders can be involved at different levels. At level 1, stakeholders receive information. They may be present, but they have no role in contributing. At level 2, stakeholders provide their views, their feedback, opinions, or experiences, but there is no commitment to act on them. At level 3, stakeholders are engaged to influence the production of guidelines. For example, stakeholders comment, they advise, rank, vote, or prioritize. So stakeholders provide information which directly influences the guideline process, but they have no direct control over decisions. At level 4, stakeholders are equal members of the guideline development team. They participate in all steps of the process and work together in different roles. Stakeholders make collaborative decisions to shape the guideline recommendations. When writing up the guideline, it is important to be transparent about stakeholder involvement. It should be clear who is the end user or target audience, and there should also be a description of how the guideline may be used. The composition of the guideline development group should be described, including any stakeholders. For each member of the guideline development group, there should be a description of their discipline or relevant expertise. And very important, each member should declare whether they have a potential conflict of interest. And lastly, there should be a clear description of how patient views were addressed in the guideline. For example, patients commented on the draft documents, or perhaps they were more involved through interviews, surveys, or focus group meetings.